It's Vishnu Mama's. You can't take anything. Leave it there.
No,
You can ask him and then take it.
okay, can I call him?
Yes, and I just started going live, so 1 hour kalama. Okay. Hello, everybody. Welcome to my weekly Locked Up with Lakshmi series. So today we have Dr. Rashmi Shetty, who's a very well-known cosmetologist, dermatologist from Bombay. I know a lot of celebrities go to her, and I go to her too when I'm in Bombay and when she comes to Hyderabad. So I thought today we will break down asal skincare ante enti. What do we need to do for men and for women, and when do we start to need to take care of ourselves? Suddenly they talk about all these different kinds of products you're supposed to use, and when are you supposed to use them, how much sunscreen vadamantaru, enta vadali, ennisarlu vadali. So I wanted to go through with all of this with a specialist in this, and so we can really understand what it is and to take care of your skin and your hair. For us, it's a lot more because we put this through ourselves through a lot of. I see Dr. Garu. I see we go through a lot because of our makeup and hair and burning it every day. But just for regular people, how do we take care of our skin? There we go. Hi!
Hi.
Can you hear me?
Yes, loud and clear.
Oh,
So good to see you.
Same here.
Yeah, I wish I could give you a huggy.
I know. Virtual hug.
I swear.
Have you been able to get out at all?
Yeah, I've been going to clinics. They've already started working.
Oh, lovely.
So doctors have been allowed, right? So we've already
Yes.
started working. And then it's been 2 weeks since we have started working. And yeah, like my daughter keeps saying, Ma, now you do a procedure between procedures. So in between every
Oh, I lost you.
that we
Sorry,
have
you
been
said
doing.
what? You're doing a procedure in between procedure? I lost you there.
Yes, so the in between procedure is all about cleaning up, sanitizing, getting your stuff pepped up again. So it's a whole procedure on its own. And yeah, it's
Abiding by the guidelines, so no more cute
completely.
dresses for you.
No, all of those
slacks
dresses and it's
PPE.
completely covered with a surgical gown.
All right, so I'm going to remove the comments now so we can see our faces each other well. Thank you, Doc, for doing this. And, the series started off as just like, let me do something I know, and it's blown out of proportion. I'm loving it. I feel like
So lovely.
I feel like whatever I'm doing is giving back so much, and people are eager of what it is that I'm doing next. So today I thought, we'll talk about what is skincare, basically, right? We were born with such beautiful everything. We're never taught to take care of our face. It's the same soap what you use on your body, you use on the face. See, me as an actor, I learned more and I got to learn more about my skin and hair, and I have the best of you people available for me, but that's not the case for a lot of people, right? So I wanted to talk about, I had terrible acne, you know that, but it's went into my late 20s and early 30s. So let's talk about puberty. When do we start skincare? And we will go point by point. Like, I just have
Sure.
questions, you know what I mean?
Yes, perfect. So skincare, by and large, you must understand, actually in India, skincare is engraved far too deep than we think it is. What do we do for the baby the minute it's born? We have a dedicated massage person, right? Which other
Yes.
country has it? It's just
Yes.
ours. So depending on traditions, they use ghee, they use oils, they use everything to massage the babies. I remember my grandma doing some special things so that there's not too much body hair on the girl child.
I
You
have
remember?
zero.
Same here, same here.
I have,
So
this is me never
yes,
waxing, never
absolutely,
doing
I can get
anything.
that. Yes.
Yeah.
So I'm saying skincare actually started right then. And even while the baby was massaged, they used to massage your nose a particular way. They hung your
Yes.
neck like this for the neck becoming long. All
Yeah.
of those was done. So the awareness of wanting to groom a human being, let's say, started off when you were born. It's just that we didn't look at it as such.
Mm.
And back to your point of teenage skincare, maybe you should start skincare the day you go to school because you're exposed to dust, pollution, sun, everything. So when I say
What do you
skincare,
mean?
two things.
School means first grade.
Yeah, two things. Face wash. So if you incorporate into your child the habit of washing your face with the appropriate face wash, like brushing the teeth. So your
What
son,
is a
your
proper face wash for kids right
you could
now?
simply use anything very gentle with nothing specific in it, anything very gentle. I usually don't like to give out names of products. There's no financial attachments here at all, but I'm going to give up some products so that it's easy for you guys. Something called as, like, say, even Pond's has some wonderful face washes. You have
Mm.
a range called Tolerion, which is a French product with Aven, available in India, which is very gentle. You have Pond's, you have Nivea, you have all of these fantastic
Cetaphil is
companies.
what I use from what I get here for
Uh,
Papa.
yeah, I mean, I like Cetaphil as a range, but Cetaphil face wash is not necessarily my
Okay,
favorite.
I use the body wash and Kari. I wasn't talking about body wash and moisturizer. Okay, okay.
Yeah.
So these are
So,
good face washes. Good to
yeah.
know.
Yeah. So, some face washes so that you incorporate two things in your child. One is face wash, and two is a sunscreen. So, it's always nice to start wearing a jet sunscreen on your face. Like, for example, you named Cetaphil. Cetaphil has a fantastic sunscreen, very safe for
Mm.
children. So you could start off with a gentle sunscreen. For those who are watching at and large, there's, like I say, popular brands like Pond's, Nivea, the L'Oreals of
For
the
kids
world, all
also,
of
do
them
we
have.
have to do SPF 50?
SPF 50 is a given to everyone. That's
Okay.
because that's probably the highest SPF, which makes sense. Beyond 50, it does not make sense.
No,
There's
there are
hardly point
lesser as
1.
well. I mean, if you want to get a more
30 to
tan or
50
whatever.
is good.
Okay.
You get your tan on your body, but on the face, because we are brown skinned, and now let's say good or bad, we're all conscious about the way we look in terms of color. I'm not saying whether you should be fair or dark, you should have an even tone. And most of us brown skin, if you see, have a patchy complexion. You have a little
Mm.
dark skin around the mouth, you have a little dark skin around the forehead, a little dark skin around the eye. These patchiness is what you're trying to avoid, not the skin color, which should be a shade darker or lighter. So if you
Mm.
avoid those patchiness, a little bit of sunscreen really helps you avoid the patchiness. That's just one thing. But a lot of children are sun allergic, especially the children with atopic dermatitis, have sun allergy. They end up with small white patches on the face. And most parents bring them to me and say, Doc, it's calcium deficiency. I'm like, no, that's not calcium deficiency. That's a part of dermatitis. Then they end up having on the hand
Oh,
tiny white bumps like this on a patch. That is
yes, yes.
reaction because of sun. So sun, as we
Oh.
think, may not be all good. So there are certain rays which are not good. So therefore, you use a little bit of a sunscreen because I mean, our school times are such 3 a.m. If you remember, 3 o'clock, we were all in the PT ground, right?
Yes,
A
yes.
horrible sunny hour. So you
True.
need that little bit of sunscreen for your children. A good face wash, good sunscreen, good dietary habits to explain to them what goes in is what shows on the skin, and come back home and wash yourself. Don't keep touching your face because you touch everything in your school. So those
Mm.
can be explained to children. That's a good start.
Wow. I had my questions written as puberty, 20s, 30s, but then you're like, start them young. Wow.
Yeah,
Okay.
yeah. And
That's really
also,
good to
one
know
more
because
nice thing to teach is to tell them not to pick. Put it in their minds. So by the time
mm,
they're 12, 13, when they get their first acne, they're not fidgeting with it.
that's a big no-no, right? First
Yeah,
thing you
yeah.
do not do when you get acne
Yes,
is touch it.
yes, yes,
Yeah.
yes.
Because my skin now you can see because I
Yeah,
got a
but
lot of treatments done to make it smoother. But
yeah,
I
yeah.
used to
So I
have
keep telling,
so much.
yeah, and I keep telling teenagers, acne, I can give you a guarantee. 1 month, 2 month, 1 year, depending on what's wrong with you. Once I do my diagnosis, I will give you a guarantee I will take acne away in a certain date that I talk to you. But a mark is impossible with all the beautiful gadgets that I may have. Mark is so difficult. It takes years, it takes many treatments, which is unnecessary. So if you can
So
take care of the
don't
acne,
touch your face when you have acne, which is a no, no, no. Because there's more bacteria. I don't know what it is. I know it just feels bumpy. I used to suffer with it, I know.
Yeah.
But that's the first thing. And then they say with acne, how often do you wash your face?
So whether you have acne or you don't have acne, do not wash your face more than 3 times. You don't need it.
But you
Two
need to wash
times
it
is
three
more than
times.
enough. Two is more than enough.
But two is
If
a
you
must,
are,
not.
no, one is not happening. Two is a must. Come on.
Because I know a lot of people just wash their face and get it done, like just a little bit. So twice a day, a minimum, and not more than 3 times.
You don't need more than 3 times because then you're taking away your own skin's oils, which is happening. You don't want to do that. One, first thing in the morning, so that your night cream, your sebum, your sweat, your probably dandruff which would have fallen on your face, your dust on the pillow, maybe your dog came and licked your face, all that is there in the morning when you wake up. So first thing to do is wash your face. And then at the end of the day, when you finish with all your dirt, grime, travel, makeup, everything, to wash that off at the end. So 2 washes in a day is a must. But if you're a school-going child, if you're an office-going person, you're taking local commute, then again, when you come back home by around 4:35, to have one in between would be a great idea.
Just to keep the skin clean and
Clean,
even.
clean, yeah.
So I keep hearing about are you using vitamin C? Are you using retinol? Are you using
Yeah.
this? I am half the time buying products and I don't know what I'm using.
Oh,
in
don't.
1 hour.
Yeah.
Because this got a great review or this smells great. but when do you start a regimen? Like I know you wash your you used to tell me no, that was another friend, Asmita. You know Asmita, a friend.
I know, Asmita.
She always used to say CTM, cleanse, tone, moisturize. Cleanse,
I
tone,
know.
moisturize.
That was a
her
very
skin is
old
like
school
baby.
ingrained thought. Her skin is beautiful. She can give
I know.
advice. Yeah.
But what do you do? So you're saying use face wash and sunscreen, start them young. But they say sunscreen, you should put it every 4 hours. Now, where will I go to put sunscreen every 4 hours, dog?
Not happening. So all you do
Really?
is, I mean, technically speaking, what is an
Yeah.
SPF? You said 50 SPF, right? For example, what's an SPF? It only means it protects, like each SPF, like for example, one SPF protects you from the sun for 10 minutes.
Okay.
So if you do a 50 SPF or on average, let's say 40 SPF, it will protect you for 400 minutes. Let's say on an
Okay.
average 4 to 5 hours. Again, for
Okay.
that SPF on the tube to actually materialize on your face, you should be applying a thick layer, which none of us do. None of us do. Yeah, because it makes you feel sticky, then too many layers on the face. You don't
And
want it.
white
You yeah, you literally have to put 1 teaspoon of it for it to get that 50 SPF.
Whoa.
Which we don't. So let's say on an average you get a 2.5-3 hours of protection when you apply any SPF on your face. So ideally you need to reapply it after 3 hours. That's why the doctors tell you as such. But that's not
Even
gonna
if
happen.
you're indoors?
See, you're not protecting yourself from the sun's visible rays. You're protecting it from the UVA, B, maybe C. C doesn't even reach the earth thanks to God's own nature ways. So it's A and B which comes in. There's also infrared which can harm you, which is what you feel hot when you go out in the sun with. It also, visible light these days have been enough papers, scientific papers to say visible light also harms your skin, especially for those people who have a condition called as melasma. A lot of South Indians have it with that cheek pigmentation on the cheek,
Yes,
which happens during pregnancy, which happens during menopause. So if you have that, you even avoid visible light. So therefore, you have large houses, all of you especially have seen down in Hyderabad, and then you have large windows. Most of you are sitting in the garden or by the window. All the
True.
sun's coming right through.
True.
So you do need a sunscreen even if you're indoor. But to come back to your point of should you be reapplying it? You should technically, but that's not going to be possible. So what I end up doing is either you end up using layers in your cream anyways, right? So your sunscreen will always be there in your sunscreen. Then in your day cream will have a little bit of an SPF. So you would have layered it so there is some sort of a protection. And then we are not walking in the harsh sun, right? So it's okay. It's okay to not apply many times. You could apply it maybe twice if you really are in an outdoor job or you're shooting outdoor. Then you could apply a second time in the midday. So you've applied once, say, for example, 9 a.m., 10 a.m., then you again reapply post lunch. That might really help you. So then, like by the time the sun sets, it's 5, 6, you're done. So 2 times a day, if you really are out in the open, is good to apply. And if you have pigmentation, you have to apply twice. But on a normal skin like yours and mine, it's okay to apply once. And we know this is the time we're getting out in the harsh sun and coming back. So that's fine.
Because you know a
Also,
lot
what
of
to extend, sorry, just to add one more point, to extend the protection of the sun, you have a lot of things called internal sunscreens, which is like an antioxidant tablet, like a vitamin C tablet, that kind of stops or reduces the damage that the UV ray causes. So those can be things which extend the sun protection for you.
I know you have a whole range of products, right, that really help you.
Yeah, yeah.
Because it's not just about what you put on your face, it's also about the vitamins you need to take. I had
Perfectly.
that question as well.
Yeah.
So
Yeah.
thank you so much for really detailedly clarifying about sunscreen, because we are bombarded with, oh, you
Yeah.
got to put it on every 3 hours and that white cake cannot happen.
Yeah.
But
Yeah.
you broke it down so
Yeah.
beautifully. But so a sunscreen is a must. So these days, even when I put a foundation or any kind of thing, I make sure it's a BB cream with like even
True.
SPF in it, because I feel
True.
like I don't need foundation anymore.
Yeah.
Just keep your skin clean. So wash your face, sunscreen. But in between wash your face and sunscreen, there are this whole
29 things.
29 things. What is it? 12-step Korean skincare.
Please.
Glass
Listen,
skin. What is
I
that?
never tell you what I can't do. I have no patience. Are you kidding me? No chance. No
I
chance.
mean, people have gone
Yeah.
mad about like what their skin looks like, and it's insane. But it takes them like such a long time in the morning to get ready, and in the evening too. But what are the simple, effective ways that you can have for
Yeah.
the rest of your life? And I want you to break it down between 20 and 30, and 30 and
Yeah.
like 20s,
Yeah.
30s, and
Yeah.
40s.
Yeah.
Because some
Yeah.
people, I know friends in 20s use a lot of retinol, and I'm like, I don't think your skin needs it. Wake
Needs
up. So
it.
can you just break that down, please?
So one, just to let you all know, skincare has become so much like fashion, like Lakshmi rightly said. You pick up a jar because it looks pretty. You pick up a jar because it's smelling nice. You pick up a jar because the lady at the counter explained to you so beautifully that your chain's gonna change, and you're like, whoa, I want that dabba.
I
So
know
no,
my
there's no,
mom's always like this. These marketers know
yeah,
they're all
yeah,
trained just for you. I'm like, oh,
exactly.
so sweet.
Yeah. Yeah. So there's no magic in a pot in the first place. So that you need to get it clear. And
Wait, say that
two,
again. There is no magic in a
no
pot.
magic in the pot. No magic in the pot. So the
Okay, I gotta
magic,
leave now.
yeah,
I was
yeah.
being nice to you to find out what part I can get to put on my face to
No,
look fabulous.
no, no.
Wow.
So one thing that I want to say is skincare, don't treat it like fashion. So it's not fashion. So don't keep changing. Also, what's happened is because of this whole consumerism, people have taken it as such where you remember the BB cream and the CC cream where they said you don't need anything but one cream. And
Yes.
they were the same people who came and told you need 10 things.
Yes.
So all I'm trying to tell you is do not follow a trend. Do not follow a particular sect thinking they have great skin. I teach around the world, right? So when I keep going around,
No, Doc, tell me a little bit. Sorry, I'm cutting you. Let's finish
yeah,
this, and I want you to really give
yeah.
me what it is that you're doing across the world, because I'm so proud of you, because
Oh,
you
thank you.
represent India and you travel so much, teaching
you.
people how
Yeah.
they should be injecting and doing all the other things. So we get to that, but sorry, finish.
Yeah, no. So when I go around teaching, the best skin, literally, like what do you call it? It's like the milk cream is the ones, the Malaysians, the Koreans. They are born with it. Everybody has it. Not all the Asians. It's just these Malaysians and Koreans. They are blessed with skin like that. It is beautiful. So don't look
Even
at
in
that.
their diet, there's so much
Yes,
fish.
yes.
And,
Their
yeah.
whole body, you look at their neck, you look at the back of their hands, you look at their shoulder. It's literally like creamy cream, not a pore in their face. That's genetics, guys. So don't look at that skin and think that happened because of a 10-step regime. No. That happened because of 10 things. Like Lakshmi rightly said, diet, their genetics, their the way. Have you ever gone to, what is this place? Vietnam. The whole country is wearing masks. I was like, what is that? They
Yeah.
do not even expose to sun this much.
Yeah.
So there are
Even the
certain,
guys who are pulling
yes,
the thing, they have their hat and their mask.
everyone. Yes,
Yeah.
everyone, an attached umbrella, this or that, everything. So, and they are all fair. They're all creamy fair, not the European white. They're creamy fair. So, and they have in their lifestyle incorporated of avoiding sun. Like you said, their vegetables, their food is so yummy, so fresh. So a lot of things goes into it. A lot of things goes in. Not the 10-step regime. No. Yeah.
So,
So go ahead with
so
your question.
what is the long and short of it? So wash your face, put a
Yes.
what's a serum, what's a vitamin C. So if you were to give someone in their 20s a regimen, saying what do you take in the morning, what do you do at night, and when do you go see a dermatologist just to upkeep your
Yeah.
skin, because that's
Yeah.
the first thing somebody sees.
Most
I
important.
really, for me, it's important, especially who are my assistants and who are my secretaries, to look good, to wear proper clothes. I tell my, because you're representing me. You can't
Yes.
have bad skin and like anywhere in the world now. If you have a problem, that's okay, but people can tell now that you just don't care, and you
Yeah.
don't want
Yeah.
that.
Yeah. So what's important just to, so let's take out this whole CTM and what should you apply to the day kind, the question first. It's important for you to cleanse your face. Now, cleanse can simply be a face wash. For someone like me on a daily basis, my skin is pretty good. It's genetically blessed. All I do is simply wash the face with the right face wash because my skin tends to dry. I use a face wash which does not make me dry. So, depending on your skin type, you just choose the face wash. That is a very good start to correct your skin type in the first place. So, you choose a face wash which has some acids in it if it is oily skin. You choose a face wash which is for sensitive skin, which doesn't dry you out if you have a dry skin. And then you have, let's say, a very oily skin and you also use makeup through the day, then you may need another oil to crack it. So you use an oily cleanser first. And then if you do have a lot of makeup, you may also need a makeup remover for your eyes and lip, which are stubborn makeup, you know that. So then you need a makeup remover, then you need an oil cleanser, then you need a face wash. Or you need a makeup remover, you need a cream cleanser if you have a dry, sensitive skin, and then probably a face wash. Or if you simply have an oily skin, you may not need any of this and just a face wash with acids. So this is the way you decide your cleansing in the first place.
I'm going to stop you right there. How do you
Yeah.
decide what is your skin type? Lot of people get confused. Is it
Okay.
oily or dry?
Okay.
Oily means do you break out a lot? Dry means what? How can one identify what kind of skin they have on their own?
I got it. So the first thing you could do is one night sleep without nothing on your face. No creams, no lotions, no night creams. Preferably no AC. So just the fan on, windows thrown open, go to bed. Next morning when you wake up, you examine your own skin. If it feels sticky and oily, your oily skin. If it feels dry and you have to like open your mouth and it all kind of feels cracked and stretched, then you have a very dry skin. If you wake up
Mm.
with something which is reddish patches of red on your face, then you have a sensitive dry skin. If you have open pores, you see early morning nice wide open pores, you have a more oily skin. If you do break up into one or two tiny zits, then you know you're an acne prone oily skin. Usually dry skin has tightly closed pores. Usually dry skin tends to be more sensitive, gets red very easily, chappy skin very easily. But an oily skin has an open pore, acne prone. Along with it, usually has an oily scalp. And dry skin usually may have a flaky scalp. So these are ways for you to figure out what your skin is. Most people
Wow.
may not be fully dry and fully oily. You may have a combination skin. In which case you may have a dry external side or the C portion of the face and a more oily center zone, which is the T zone of your face. It could be a combination skin in that case. So not everyone has an exactly same either dry or oily. It could be
And it
patchy.
changes with the weather as well, right?
Yes, it changes with humidity, with season, with your hormones. While you grow up, it can change. It can change with your hygiene. It can change with your scalp health and hygiene. It could change with a whole load of those things. It could change with your diet. So, yeah, there's nothing as a constant in terms of skincare. You're evolving, your skin's evolving. The same day in the morning, your skin might feel a certain way. You land in another city, another country, it might feel a different way. Yeah. So that can
Yeah.
happen. So this is how you determine your skin type. So we finished with cleansing.
Thank you. That was very, very clear. Thank you so much.
Thank you. So skin, now we have finished with how do you cleanse your skin, right?
Yes,
So
yes.
now what is a day regime? So now, like Lakshmi asked, there is a, let's just broadly categorize it. There is a serum, there is a cream, there is a powder. Yeah. So how I decide my skin care when I give it to a patient is one, I see, do they need nourishment? All of us need nourishment.
Mm.
Do they need protection? All of us need protection. Do they need correction? A few of us need correction. So these are the three things I look at it once the cleansing is over. So protection, of course, from sun, wind, pollution, and antioxidant damage. So that usually is done by a good antioxidant cream or serum and a sunscreen. So in the day thing, you need a sunscreen for sure. That's a given. So let's take that away already. Then you need an antioxidant cream, serum, or let's say milky kind of light cream. You need that in the morning. So two things you need in the morning. And how do you decide? If you do have a oily skin, you usually go in just for a serum or just a very milky light lotion. But if you do have a dry skin, then you go for a creamy cream. And over this, you apply a sunscreen. To me, 2 layers in the morning is more than enough, especially people in India. We sweat, we go out. It's not that the whole country is under air condition, that you enter the air conditioned car and get into the air conditioned zone. A lot of us do, a lot of us don't. So you need to take into factor that you get out of the house in the morning, come back in the evening. It will get sticky. It will start looking dark. 25 layers on the face would just make you feel all sticky and messy. So it's important for you to just have 2 layers in the morning, more than enough.
But I
Unless,
think a lot of people are going to go like, aha, thank you so much for saving us, for for saying that
yeah,
even,
yeah,
because there is so much stress. What, you don't take this, you don't do that? I'm like, I don't know. I've been good at washing my face in the
yeah.
evenings, which that is
More than
so hard
enough,
for me.
more than enough. And in addition, if you're like a 40 plus and you need your eye cream and a cream around the mouth, because these are the, again, places where you kind of start to dry really fast. So it pigments, it kind of gets lines. You don't want that happening. Then you add another eye and a lip cream, usually, which can be one. Eye cream can also go as a mouth cream and a lip cream. So you add that, and then you finally do your sunscreen. So that's the difference between a slightly younger and a slightly more mature skin. And then comes your night regime, which for me is very important. So in the night, you can go and indulge like a Korean. If you have all the time, you buy a little fancy serum that kind of gives you that extra hydra boost. Then you look at your vitamin C. Then you look at your niacinamide, another favorite ingredient of mine. Look for a nice HA cream. So look for these, layer them leisurely. That's also a good me time. It heals you. Touch your face, massage your skin, neck, face. Just give yourself that, nice, beautiful time before we all are multitasking. Men or women now, right?
Yes.
So you hardly rush back from the office, even if by the time you're talking, finishing the phone calls, you come home and the whole family pounces on you.
Yes.
So take away that 5 minutes for your 10-step Korean regime. So sit there,
Is that
yourself.
Upo in the back? Did I just
Yes.
show?
She's going to run away now if you even name her.
I think
They're all
she's
saying
stuck
now.
there. I can still
Yeah,
see a
she's stuck.
t-shirt. Oh, now she ran.
Teenager. She'll run away from there. So,
Wow. So at night, then you're saying, then take your time and whatever creams you buy. Then
then it's
vitamin C
indulgent.
is something you recommend.
Yes. Then I recommend a
HA
nice
cream.
hydrating serum, HA serum, skin lightening. This is the time you can take care of those patchy skin we were talking about. So use your skin lightening creams that the doctor has prescribed around the mouth, on your forehead if you have a pigmentation, around the eyes.
So the
Take that
lightening
time.
creams are basically to help you with your pigmentation, not that your skin color will change.
Skin color never changes. Please don't go
Say
chasing
that
that.
again, please.
Skin color never changes. For all of those of you who are running to various doctors' clinic to get your this shot and that IV and that this and thinking you're going to become fair,
My next
guys,
question,
no.
It's not
Yeah.
working, huh? It's just a
No,
boost
it's
of
just
antioxidants.
yeah, it just yeah, exactly. Boost of antioxidants, you're feeling happy, your system feels nice, your liver feels cleansed. You're happy. Do it in a limit at a certain interval. I've seen people go nuts over it, and we have to tell people no, no. And
It's
then
not
some
good.
listen, yeah, some go elsewhere, get it done, all that happens. I'm like, no, guys, this is skincare. Take it seriously, take it safely. Like, I'm a part of these 20 doctors from around the world now, the top doctors from around the world now have a group which we meet on Saturdays to generally discuss because a lot of things are happening because of COVID. What's happening? Our conferences have gotten lesser. So, to put protocols to a lot of things, we meet every Saturday. And this time, we are actually coming up with a slogan where all of us are going to sing, saying, "Your beauty counts, stay safe." It's only because we are telling people this is not the time to look for bargains. This is not the time to go and look for, oh my God, let me take a this package, that bargain, this discount. No, beauty business is serious business. It's medicine. It's a branch of medicine where we guys study for 7 to 9 years to get into this. So
Yeah,
don't
true.
trivialize it and don't think, I can pick up anything. Let me tell the doctor what to do. This doctor told me, no, I will run to another doctor who will anyway oblige. So
No,
don't do those
what do you
things.
mean? We're all Google University graduates, like
Exactly. Oh
PhDs.
my God. Yeah.
I'll also come to doc like that. I'm like, doctor, I read this day. She's like, where did you read?
Where
What
did
did
it?
I read? I learned about it. I didn't read it in a magazine.
Yeah.
No,
Yeah.
but tell us, like, so you are a part of this group that
Yeah.
really looks at what are the next
Yeah.
new and latest
Yes.
greatest.
Yes.
So talk to us a little bit about that.
So basically, we are all sitting and thinking of how to stay safe, to be honest. That's the core
Mm-hmm.
discussion which is happening now to say how to keep the practice going, but very safe. What are the protocols? So we ended up deriving a few protocols which will now be passed on and followed by everybody. So these are things that we do now, but mostly what I teach is what's on the cutting edge. Maybe it's fillers. Fillers is a tool that you all know, but how do we evolve? How one face you can make out that, oh my God, she's done something, another face you would never know is touched.
Yeah.
So tool is a tool. It's like a paintbrush. What do you do with it is the fingers behind the tool. It's the doctor's
Mm,
expertise. So these are things with those little nuances, little advances, little insights into anatomy. All of this is what we discuss and we come across. So that's what I do when I teach and I go around the world and do things.
that's fantastic.
I know.
Now let's come to
Back to the skin regime.
hair regimen. I think we did the
Aha.
morning and the night creams. That was very clear, simple but effective. And now, what? So I grew up with oil in my hair, going to school with two pigtails, oil dripping down my face
Yeah.
because they believed the more oil, the thicker hair.
Yeah.
No.
No. Genetics again.
Castor oil, this oil, that oil. I think I
Mm.
have the most hair out of my whole family really at this point, my mom and me. Like,
Yeah.
but that also a lot of treatments from you, doc. My PRPs. I know you were not going to say it, but
No.
no, because as we burn our hair and blow dries and
Yeah. Yeah.
this event, that event, you
Yeah.
can't hairsprays. You
Yeah.
got to upkeep it. I tell you, I at least this much I have because I've been coming to you. So
Yeah.
thank you for
No,
that.
see, you are among the special point one because your
Mm,
hair is abused thanks to your profession. You have to straighten, like you said, you have to look different, different day, different character. But general population may not have that much abuse, but now I'm seeing even teenagers do because they also want to look different. There is a selfie camera every day to want to look perfect, so they're blow drying every day. So that's there. But the hair regime, what you could do is oiling is always a fantastic thing to do. So
but
please
how
oil.
long do you keep the oil in your hair for?
So I
Or
was
just
on the
keep it for
board of
overnight, day, nights?
yeah,
What?
yeah. So I was on the board of scientific board of Parachute, which is the Parachute oil, coconut oil company. So
Yes, of
Marico. So
course,
that's
we
where I was.
all know. Yeah.
Yeah. So there we did a scientific studies which said there's a big difference between keeping oil for half an hour to keeping oil for 12 hours, right? So the penetration of the oil really depends on how long you keep. Coconut oil especially has got that thin chain, and it is one of the straight chained oils which penetrates your hair shaft, and it can actually go into the innermost core of your hair shaft and actually hydrate it. So oil,
Really?
keeping the oil overnight, like how all of us South Indians did, is actually a good thing. But only thing is the next day that they put so much shampoo and rubbed it off, that's not a good thing. So when you wash off oil, don't get so aggressive to have every ounce of oil removed from your hair. You could only do one rinse is enough because again, as I say, coconut oil is extremely light oil. It comes off. And all of us have long hair and thick hair. So what you do, what my mom used to do, this is more than scientific, my mom's tip is she used to take shampoo in a container and dilute it for us. So you're not using too much shampoo, you're using diluted shampoo, which spreads then along the length of your hair easily. Instead of going
Why
on
didn't
putting
I would
shampoo.
have saved all this money all my life if you had
Yes,
said this, job.
yes.
Wow.
So that's
So
something
it's
that
the
you do.
same consistency. You just
Yeah.
dilute it a little so it goes all over your hair
Little, no, she
rather than you
literally
taking
5 times
the thick
diluted
one.
it.
Yeah.
5 times diluted it. 1:5 water, diluted it, and then put it all over. So you use only this much shampoo, but you have rinsed out your whole hair. And that's more than enough. And before you put shampoo, make sure your hair is fully wet. A lot of us stand under the shower for 1 second and then take shampoo and start putting it. You literally open out your hair like water, water, water. So all your hair is fully wet. Then you use the shampoo. So it works well. So you've shampooed, you've conditioned, very important for hair routine. While you apply the conditioner, work along your hair, leave it for 5-10 minutes, even longer if you have the time and the luxury, and wash it off. Wet hair. Wet hair is something that I always, our mamas tied the wet hair in a
Yes.
towel, which
Yes.
scientifically makes sense because it doesn't then grab moisture or lose moisture instantly. And the wet hair, the cuticles are all open, so that can grab the moisture very quickly. If it does, it swells and later it becomes frizzy and brittle. So if you tie your hair, the moisture stays in, but the hair is not kind of taking the humidity quickly and drying quickly. It's that combination that doesn't happen. And then when the hair is half damp, you use a little bit of an oil and just scrunch your hair. Yes, half damp, use oil because then that seals the moisture inside. So your hair is not so dry and brittle. So now the West is also talking about it. How many post-bath oils haven't you heard of? Right from a L'Oreal to a Vela to a Precious oil to a this oil to a that, everybody's got a
There's
post-bath
the
oil.
Moroccan oil with just that one product made billions of
Exactly,
dollars.
billions for that company. So that's
That
nothing
also
but post-bath oil. Yes.
Post bath. Yeah.
So when the hair is wet, you just take $1 for $2 of it. Just do this.
not
And
like
just,
the usual when you put
no,
the oil.
no,
but
no,
just
no, no.
tiny
Just
bit.
a dollop of it on wet hair. So you do that and just run
like
your
that
fingers
much?
through it. Yeah, maybe one squeeze for my hair length, maybe 2 squeezes for a longer length.
Okay.
And then on wet hair, just do this. And if you have straight hair, of course, you run your fingers straight into it. If you have curly hair, just do that and scrunch it. So that's what you do to keep the moisture in for a long time. Then it doesn't frizz out.
Doc, why? I mean, I've known you for years. Dude. I don't know all this. What is this?
We haven't
I
had
know
this much time to chat, no?
I know it's like yeah. So now I want to talk about. There is a lot of talk about PRP. Explain what that is for a layman,
Okay, done. So
and
PRP,
why you inject it in your hair and how does
Sure.
it help?
Sure. So PRP is when we take out your blood. In your blood, all of us in high school knew there are various things, right? White blood cells, red blood cells, and plasma, right? So
Yes.
plasma, there was platelets floating in the plasma. Now those platelets are very rich in growth factor. So when you take the platelet from the whole blood, so that's how your doctor takes away blood from your body, then she takes it in different specialized test tubes, and those test tubes are then spun in a particular speed, which then separates the blood components. The serum is taken out, which is rich in platelet, and that is injected back into your scalp. Now that then puts there the growth factors to help the hair grow from your follicles, which now might be, let's say, tired or stimulated by something or lacks stimulation but is sitting there quietly. Those are stimulated by the plasma, platelets in your plasma. So that's how it works. There's platelets. There is also other things than platelets which also help. There's fibrin which also helps. So all of this really helps you, and you usually do it once in 15 days, along with, of course, first making sure why do you have hair fall. You could simply have a thyroid issue and you don't need PRP at all. All you need is fixing your thyroid and your hair will be fine. You might have a nutritional issue like iron deficiency anemia. So don't go and just get PRP for everyone. So please make sure your iron deficiency, if there is, that's fixed. If you
So
do
what do
have
you
other
recommend
nutritional deficiencies,
when you go to a doctor, do your blood work and go because you can see
your
what
doctor will tell you the blood work to be done. And your doctor will tell you there's a nutritional panel, there could be a hormonal panel, but not necessary that you do blood work. There's a lot of clinical history we take. In that, we get to know whether, let's say, you have iron deficiency anemia. I might have already asked you, do you bleed enough during your period? Do you bleed excess during your period? Do you feel tired too soon? Can I see a dark circle under your eye? Can I see your hair kind of gradually becoming thinner? So these are a few things I would ask. Then I know it could be nutritional. If I end up thinking you have too dry a skin, you again feel too tired too soon, it could be thyroid. There is a family history of thyroid, then that's what I might get done. But if you do have issues with your periods, you have acne on your face, you have hair growth on your face, and then you have hair fall, then I know it could be a PCOS or a
PCOS,
PCOD, what you call it.
PCOD.
Yes,
I
so
know
you
I've
could
been
have
written
that.
PCOD, endometriosis, pigmentation. I've written down
Exactly.
these
Yeah.
are like the first things all girls ask
Yeah.
for,
Yeah. Yeah.
and you do see a difference in your
Yes.
skin
Yes. So
when
then you end up
something's
doing
off
those
balance.
tests. Correct. So you can see in the skin, then I will say either this set of tests or that set of tests or that set of tests. It's not that everybody gets a blanket tests. That is where the difference is when you go to a right doctor, right institution. It's very important. And then don't just go and say, how much do you charge for a PRP? How much do you charge? So let me go get myself some PRP. Don't do that.
Yeah.
So that's why it's important for you to be more aware of who is your provider.
Our since we've gotten thank you for that. So that's clear. So if you want first go to a doctor, don't just go
Yes.
because
And
you
look for
read somewhere
treatments.
PRP is
Yeah.
important.
Yeah.
Don't just
No.
go get it. You might
No.
not even need it and waste all that
Exactly.
money on yourself.
Yes. Yeah.
So I know fillers are a rage now. I've got my nose done because of my little. See, I'm
Dent.
sharing everything.
Yeah.
I fell and I
Yeah.
had an accident and I had one dent here. Now I
Dent.
don't have it.
Little
See,
dent. Yeah.
because I put little Botox in there. So
Filler,
my
not
nose.
Botox.
Oh, filler.
Okay.
I should know better. So it's become smoother if you see.
Yeah.
But
Yeah.
now, you know how I'm obsessed about like
Yeah.
skincare and all that. I've been looking all these
Everyone.
doctors,
Everyone. Huh.
all the doctors. I'm
Yeah.
Insta queen.
Yeah.
Doc, nowadays you don't need to even you don't need to get a nose job done. Even that is achieved with a filler. I thought that was brilliant because noses, I thought you only had to do like get
So
a
the other day
surgery.
I was working on a patient who had years of accident and a nose fully crooked. It was literally like this, her nose. And then she had also gone through a surgery which hadn't fully corrected. So then we did a beautiful job just with a filler. Now she has a nice aquiline nose. Only thing I cannot do with the filler is make a big potato nose into a small nose. That I can't do with a filler. We could achieve a little bit of sharpening if it's a big and a small nose, but if it is a fat and a big nose, there's very little we can do with it. That definitely needs a surgery to cut it down to shape. But if you have no bridge, if you have a dent, a lot of people have a strong in between bone and then there is like that nose, you know?
Yeah, there's a little
Yeah,
bump
hump
there.
there and another hump. Exactly. So that we
Yeah,
get
yeah.
great results with. Nose which looks down, we can get a great result with just getting the tip like that. So all of these little shaping down, we can do
Do I
beautifully
need a
well.
tip like that? Do I?
No, your nose is beautiful. And then there are people who come and say, my nostrils are wide open, I can see it that way. Then we end up using a little bit of filler along the aloe of the nose to bring it a little nicer. Some people, when they
Really?
keep talking, the nose keeps going like that.
Yeah.
Yeah.
It
So we
flares.
end up doing a little bit of a Botox to cut down the flare of the nose. And then the nose keeps dropping as you grow older. So then we do a little bit of a Botox there to kick that nose up like that. So there's so much you can do. But only thing is, like I said, the doctor has to have the aesthetic eye to say what looks good on you, what should be done, how much should be done. Should it, when I
Because
touch the
some
nose, yeah, some look, oh my God.
you
Yeah.
can
So
tell
you
what's
don't
going
want
on.
to
I'm
do
like,
that.
whoa.
Yeah,
Can I
yeah,
tell you something?
yeah.
Like, I feel like I need to tell you, like, this is not looking
What is
good.
it? And you can't because you think it's rude to tell them that. So you don't, you hold back. So that's what happens. So it's important. Filler is one of my favorite tools. Like I was doing this, because of the, what do you say? COVID, a
COVID?
lot of people are doing these Insta lives, right? So one of my doctors from London was doing 20 pointers to know all the, according to him, the diva doctors. So we did it, and he was doing it with me, and he was asking me, "What's your favorite procedure?" And that's when I said fillers. To me, it's like a stage acting to an actor. I finish the job. It's instant. I can see the result instantly. I show the mirror and patient is like, oh, doc, I love it. And that's all the satisfaction I have. It's literally like
Yeah,
you finish an act and you have the audience get up and applaud. To
yeah.
me, it's like that.
But now, with lips, everybody's
Yeah.
obsessed with lips. I'm
Yeah.
obsessed with lips.
Yeah.
I don't know why you won't do my lips.
Uh,
I think the
You
little
shut
bit that you
up.
did,
You don't need it. Oh my God, you don't need anything. Just shut up. You're
but my
blessed.
lips, doc. I think
Your
just a
lips are
little bit,
most
like I'll have.
beautiful. Oh God, that would make you yucky. You look beautiful. You have the lips like a child. You know what makes your face look like a child? It's those lips of yours.
Oh, thank you.
Yeah, like a
I do
child.
have crooked lips though. When I
That's
speak, I
fine.
speak.
That's fine. That's
I don't
fine.
know why I can't
Asymmetry
let
is
you.
beautiful. Asymmetry is attractive. Asymmetry is art.
You won't have any clients coming to you now. Look at this doctor
I
won't do
say no
anything.
to
I've
more
been
people
asking
than
her
saying yes.
for what 7, 8
Yeah,
years. No, like I've been asking,
yeah.
can you
No,
do something, do something.
no, no, no. So yeah. Yeah, lips
But
is a beautiful job to do. We do so many lips and people won't even know I've done those lips. So that's the
mm,
beauty of it. Lips is another place which shows age. It's
ah,
not necessary that you want to have a ducky lips or you want to have a full lips. Lips, when I do a little bit of lips, it takes away the age from your face so beautifully well because all of us, the lips become thin as you grow older. The lips becomes crinkly as you grow older.
yeah.
All you do is a teeny weeny bit of lip and it makes the face look so youthful, so fresh.
What is your
So,
new? Thank you so much. You know, we're almost time. We've been
oh,
talking for 50 minutes, but I
whoa,
want to.
okay.
I know. I thought it was going to be a quick, like, hey, doc. I don't
I
want.
know.
There's so much to ask, and
Yeah,
the numbers keep increasing as
yeah,
I'm seeing them.
yeah.
But how? What are the latest and greatest techniques right now that you can tell us? With COVID, nothing.
So,
Going to a
I
doctor,
know.
we're very
Nothing.
scared.
No, no.
But
The
how do you see
point
the
in
future of
medicine, yeah. So the point in
everybody wearing
medicine,
face masks now?
no, no, that's going to go. Trust me, that's going to go away soon. That's going to go away very
Really?
soon. Yeah, yeah, yeah. Come on. It is going to go away soon. Immunity is going to catch up. There has been so many infectious diseases we have fought and we have come all this way. We're going to fight this. Our immunity is going to fight this. And India is, I know we hear numbers, but it's not that bad for a huge populated country like ours.
Is it
Also,
because we've taken
nutrition
so many
depleted.
vaccines?
Yeah, of course, BCG was given the credit and said we've taken that vaccine. It could be that. It could be our immunity. It could be the strain of the virus which has infected India is a different strain than what it infected UK, Spain, US, and
Italy
Italy.
and US.
Correct.
Yeah,
So
yeah,
there is A,
that's
B,
right.
C, three strains. So it's a different strain here. So a lot of things have contributed to why it is not that bad. So let's keep our hopes big, and it's not going to be once the herd immunity sets in, number of deaths will start becoming lesser, which is already not too bad in India. So no, don't lose heart, don't lose hope. Having said that, yes, now is not the time to suddenly remove your mask and go blasé. No, you need your mask, you need your protection, you need to be wise, you need to be prudent. But eventually, it's not going to be the life. No, it's not. So we're gonna get out of this soon.
We're gonna bounce out of it.
I know this too shall pass.
Yeah.
And so what I was wanting to tell you is medicine is not like fashion. Things don't change so soon. It is evidence based, it is scientific, it takes time for us to figure things out. So anything new doesn't keep coming in like that. Like even something like a fashion or a makeup or a color, you see something which has been is the one which is rotating.
Mm-hmm.
Honestly, tell me what is a real new thing which has come? Nothing. There's not one thing which you can say is innovative, really new thing in fashion. No. Anything that you look
No.
at your hairband, which is so beautiful, so Victorian. So yeah, I mean like that. And today it's back to whoa, it looks so beautiful.
Yeah.
So
I've
likewise in
realized only so
medicine,
much people are saying it doesn't matter what I wear. So
if
I'm
you wear
trying to
shorts
like,
down, nobody will know.
no, no, I am also in tracks only right now. But at least trying to put
Yeah,
together until how
yeah.
much you can
How
see
much you
me,
can
you
see,
know?
that's it. So yeah, so back to what's new. So what's new is usually what's new with what's existing. For example, that we discussed filler now. You said, whoa, nose is happening. So like that. Filler is a tool. We've understood the tool. We know the interaction between the tool and the human body. We know it is safe. We know what to do if things go wrong. We've understood it very well. Now we are exploring different things. For example, nose. For example, lips. For example, under
Under
eye.
eyes, people
Under
have
eye.
some really
Exactly. Hollow under eye,
hollow.
which looks tired.
Yeah, but they
So,
get really sad. They're really young, but that little
correct. They look
correction can
sad.
do a lot.
Big
Yeah.
magic, big magic. So we do that. Like Botox, when initially was discovered or seen by Dr. Carruthers, who was from Canada, it was just to take away the lines around the crow's feet. Now we do to tuck the neck, shape the face, get the nose up, like I was telling you, huge indications. So once we understand a tool, that takes a long time, and that happens once in a century or once in a decade. Once that happens, we still develop newer indications, newer ways of using it. Then you start refining it. Like from good, it becomes great results. It's like a lot of people, doctors will go, they'll say, okay, let's put a few points here, let's put a few chin, and everybody looks alike, which looks,
Looks alike.
yeah.
Yeah.
But then there are a
Yeah.
few doctors who've evolved in telling you how to keep your face like you are, but let's just make it a little bit more attractive, little bit more youthful, little bit more fresher, but keep the essence of you to you. So that's
Hmm.
evolution in your skill. So like this, you will start seeing evolutions happening.
So, in America, these med spas are big deal. So
Yeah.
estheticians start
Um,
injecting you.
no, thank
And there are
God
some,
that trend is not in India yet. Thank God for
yeah,
that.
it,
Yeah.
it, it's quite scary because,
Yeah.
again, when you see online pictures and it can go
Scary.
really, really
No, things
wrong. So
can go really wrong, guys. Especially
go to a
fillers. Yeah.
proper
Yes.
doctor.
You
Yeah.
can go blind, the tissue can die, you can die, mentally you can get strokes. There are so many things that can happen when fillers go wrong. It's very rare. Doesn't happen mostly with anyone who is really well trained. Can happen with something which is very, very unfortunate, but that's that rare if you go to a right person who knows the anatomy, who has the experience, who's doing it. Like I keep saying, these are not places where you need to look for quick fixes, quick bargains. No, you need to go to an expert. You need to go to someone with science backing, medical
Mm.
backing, rather.
Wow. I think I covered everything I wanted to,
You
doc.
did. I saw yesterday the little one of you was driving you around. I'm like, what? When did she grow up?
I don't know when. Manoj
Yeah.
had bought that toy for her a long time ago, and I thought it
Full
was too
control she
big
was
for
in.
her.
Yeah.
Yeah, and she drove with me behind her
I saw that
with
and
that weight.
concentrating, fully concentrated. I know you. I am sure you'd have had one camera following her from the front, one from behind, and 20 people. No
Yeah, yeah.
intimidation. She
No,
was
no,
nothing.
nothing.
Wow.
Just around our house. It was just
Yeah.
amazing. So
And I saw her
now
doing
if
the
the
real
time,
nirvana and the meditation. Wow.
yeah, she sits with me
Wow.
for 20 minutes.
Wow. I can't.
I know. And she says, Amma, I want to get up. My eyes are saying get up. But then I'm also saying it's okay, let me sit. So she's telling me that she's having that fight in her mind, but she wants to finish it. Something
Wow.
else way that girl is really. Yeah.
Wow.
I can't
Blessing.
wait to see you,
I know. I can't wait to
Rashmi.
touch people that I love,
I
especially you. And I love the
I
warm
have
hugs you always
media.
give. You have
I
nothing. Shut
need
up. You have nothing. Everything is
This is the
looking good.
first time I haven't been anywhere. Like, I don't do facials. I usually come to
Yeah.
you for an
Yeah.
oxygen facial.
Yeah.
That's all I ever get
Yeah.
done.
Yeah.
But then, oh my God,
You
even that
don't.
not.
And now I think all of us are eating food at home, staying indoors,
My
less
skin's never
stress,
been better.
good sleep. Everyone's
Yeah.
glowing. Good.
Yeah.
That's all is what you need, like I keep saying.
Fantastic. Yeah, I know everything that happens in the kitchen, I keep taking it on. Oh, give me that cucumber. Give me
You
that
can put it on the
tomato.
face.
Just like,
Yep.
yeah, just
Yeah.
rubbing it
Yeah.
around.
Yeah.
That has been great, really.
More than enough.
But
Thank you for having me. Oh, I love it.
it was